Guys, this is step two or part two of a question that I was trying to answer. There's been multiple questions that have came in, and I had an email from a very nice lady named Mary, and she had asked a number of questions, kind of bullet points, kind of in a row that many people have kind of asked me, and I've been answering kind of via online and directly via email. And so the second part of this running video series is when you get diagnosed with something, whether it be cancer, diabetes, high blood pressure, cholesterol, you want to lose weight, bottom line is that you get diagnosed with something. What are the steps? What do you do now? And what happens, and I was diagnosed with late stage cancer 17 and a half years ago. So I was kind of one of these people, like a lot of my viewers and a lot of my people that are calling and emailing in, that I've been diagnosed with something, or I think I might have something, but I don't actually have a diagnosis yet. What do I do? Where do I go? And so I just kind of want to take you through a couple steps of things that you're going to need to do. So the majority of people are going to have some primary care doctor on whatever insurance plan they have, whether that be a naturopathic doctor or whether that be your MD or DO. And so bottom line is that you're going to need to go to one of these different doctors to go in there and go through a physical exam and let that doctor figure out what is the pain, what is the problem, what is the diagnosis or the symptoms that you're dealing with. From that point, myself or your MD, DO, or another naturopath will come up with a diagnosis that you have, which is the reason why you're having those symptoms. So what do you do then? So at that point, most likely there's going to be a myriad of different blood tests that are going to be done. If it happens to be cancer, there's going to be tumor markers that may or may not be done. There's going to be scans that could be done, and the scans can be anything from something as simple as an X-ray, something as simple as an ultrasound. You could get a CAT scan done, an MRI done, or a PET CT scan, or just a PET scan done. Those are kind of the normal conventional tests. A lot of naturopathic doctors and some MDs are starting to switch from mammograms and certain ultrasound tests. They're starting to use a lot of thermography, which are thermal images. And so it kind of picks up heat in the body, and we can kind of go into this later. But bottom line is that whatever doctor you're seeing is probably going to want to get some different blood work or scans getting done. That way, they're probably going to call you back in the office within a week or a couple weeks, and they're going to say, okay, we did this scan, we did this blood work, and here's what I think your diagnosis is, and now we're kind of confirming it via blood work and or the scans, okay? And so once we kind of have a clear picture of what we're dealing with and where it's at in the body and what we've got going on, that's when the doctor is going to say, okay, now we're going to do this, whatever that may be. So if you go to your conventional medical doctor, the majority of the time, if not all the time, they're going to say, okay, your diagnosis is X, and so I'm going to give you this drug, or I'm going to send you in for this particular therapy in the hospital, which is usually some kind of drug therapy. If you go to your naturopathic doctor like myself, I may suggest a drug to you if we absolutely need to go that route, but if I don't need to go that route, I'm going to try everything under the sun before I go to drug therapy, in the appropriate case, obviously. And so treatments that your naturopath or myself would be doing are things like IV therapy, vaccine treatments, acupuncture, herbal medicine, supplement treatments, hot infrared thermal beds or sauna beds or domes. There's a number of different therapies that I like to use before I ever go to writing a pharmaceutical prescription. You know, don't get me wrong, if I get in my car, unfortunately, and get in an accident and I have to get taken to the emergency room, give me all the drugs you have to save my life. But 99% of the other time, unless I actually need that drug for some reason, I'm going to try everything that's natural before I actually go to a drug therapy because of all the side effects and problems with drugs. And most of the time when doctors put people on drugs, what happens is that they give you whatever that drug may be for that symptom. Well, that drug causes usually 10 to 15 side effects. So over the time as you take this, many people end up with side effects from that drug, and they have to be put on another drug. So anyways, answering the question, or getting back to this, is that bottom line is that you're going to need to go into your doctor. You're going to need to tell them your pains, problems, symptoms. They're going to most likely give you some form of a diagnosis, but then they're going to want to confirm that by doing some kind of blood work, tumor markers, scans of some kind, biopsies if they need to get done, if there's something that's there that we can actually get to via a needle and biopsy that. So that is kind of the procedure of what steps would you be taking to get your diagnosis. So we're going to get back to this subject here in the next coming video. So look for part 3 of the video coming up here. And again, my name is Dr. Joe Brown, and if you have any questions, you can call me here at the office. We've got 2 direct lines, 480-456-8600, and my direct line is 602-421-2613. And you can also reach us on our website, which is drjoebrown.com. That's doctor spelled out. So thank you for the questions. Keep them coming, and I'll try to answer them all as fast as I can. And again, look for part 3 of the videos. Thanks, guys.